Hello all, welcome to Safety and Health in Hotel Housekeeping. For today, I'm going to talk about safety tips that people often make when they use a heating pad to relieve muscle tension. The application of heat therapy is one of the common physiotherapy treatments, but are there anything we might have missed out? Let's take a look. First, let's review the function of heating pads. It helps to improve our body blood circulation. They help to reduce muscle tightness. What it does is dilating the blood vessels surrounding the muscle tissue. This brings up the body metabolic rate, which means to get a faster rate of getting oxygen. Since the heating pad is such simple and effective physiotherapy that most of us can do at home, I share this technique with my patients a lot of time. However, there are two common mistakes my patients often do. The first mistake, they put the heated pad directly on the body. A conventional heating pad from the microwave should be wrapped with a cotton towel. This towel will be the insulating layer to conduct the heat between your skin and the pad. The second mistake, they put themselves asleep because it feels so good. Staying awake is important, so that you can tell if it's too hot. You may wonder how hot it can reach up to. The surface temperature of a hot pad can be up to around 32 to 40 degrees Celsius, in other words, 90 to 105 Fahrenheit. Therefore, what can be the worst case scenario of using a heating pad? The answer is having skin burn. Three common reasons that can lead to a skin burn are excessive heat, excessive pressure, and excessive time. Which means, number one, we have to be cautious of the watt setting of your microwave. Is it equivalent to the watt setting to the user manual? Number two, to avoid excessive pressure, we must never lie on the top of a heated pad. A contact with compression is dangerous. This is especially important for people who have fragile skin. Please only try to wrap the heating pad around your waist in a sitting position, or get your body lying face down, with the pad putting over your lower back only. Number 3. To avoid getting skin burn because of overtime heating treatment, set a timer for 20 minutes. 20 minutes is a good time to achieve a good result. You may wonder, how do we know if we have skin burn? Is there any warning sign? From my experience, if your skin appears in patchy red or you start to feel itchy, it can be too hot already. Next, what to do if you catch a skin burn. Before you go to see your doctor, you should try to run normal temperature tap water over the affected area to cool the area, not using ice, not ice water too. Although applying a hot pack looks simple, but there are still precautions and contraindications that we should know. Number 1. People with skin sensory problems, for example, dermatitis. Number 2. People who are too young or too old at home are not suggested to use a heating pad as well. Number 3. People with circulation problem, such as heart disease, deep vein thrombosis, peripheral vascular disease. Lastly, people with the following condition should pay attention if they can use a heating treatment, such as pregnancy, scar tissue, having tumor, or metal implants. Please talk to your doctor if you can use this form of treatment. My bonus tip for you, do not apply any pain relief gel before having a heating pad, cause some consists of capsaicin, which is an active ingredient of chili found for fixing joint pain, that you might feel irritating when having both. I respect housekeeping room attendants. Their hard work, their focus, their caring are my motivation to create this podcast. If you're working in hotel industry and have questions about housekeeping, safety, and health, do drop me a note in my Facebook group, Pain-Free Housekeeper. More resources are waiting for you at our website that you can find in the bio. Thank you for staying with us. I'm Daisy, host of this podcast, Safety and Health in Hotel Housekeeping. It means a lot to me if you would consider subscribing to it. Until then, take care.